Hello, everyone. My name is Katrina. I'm a pelvic floor physical therapist, and today I'll be doing a very quick masterclass on how I believe anyone who is pregnant, whether you're in your first, second, or third trimester, should see a pelvic floor physical therapist for not only comfort during pregnancy if you're having any aches and pains, but also really just to prepare for birth, to really learn about what happens anatomically, physiologically, and just to become informed about um, different things that you can do to prepare for it so that you feel a little bit more informed, more educated, and less nervous or anxious about the process or what might or might not happen. So, I really hope you enjoy this. So today's outline will talk about why prepare for birth, what your pelvic floor is and its job during delivery, how pelvic floor physical therapy can help, and what it looks like to see a pelvic floor PT. And then I'll also go over just a few foundational exercises that you can start with during your pregnancy to prepare for birth. So I think it's really important to prepare for birth. If you think about it, anyone who has maybe a knee or hip replacement, any type of those surgeries, they often receive physical therapy before the surgery, and they also receive PT afterwards. So I highly recommend that. The same goes if you're planning for a vaginal delivery or even a C-section, to have pelvic floor PT before and then also afterwards, because your body goes through so many different changes in terms of, for example, building more weight in the front of your body with the increasing size of the breast, and then just milk production, the placenta, amniotic fluid, and the baby. Your posture changes, your pelvic alignment changes because it's trying to accommodate the growing fetus. And just research shows that women who are well prepared for birth are more likely to have a smoother birth. So I hear this a lot from my patients. A lot of them that come to me have no idea about like anything, about what to expect. Um, they haven't taken any birth classes. Even the birth classes aren't really specific to pelvic health or pelvic floor preparation. So I really encourage you, if you're watching this and if you are on the fence of seeing a physical therapist during your pregnancy, and if you don't have any pain, you're like, why should I go? And a lot of my patients come to me and they aren't in any pain. And honestly, we just meet for a few sessions, whether it's like 2 to 3, sometimes 4, and we go over different strategies and just information to help them feel more prepared. So some of the topics we go over are like what the pelvic floor is, what its job is during birth. A lot of people believe that the pelvic floor muscles actually push the baby out, but it's actually the uterus, and the pelvic floor muscles need to relax and get out of the way. We also go over different pushing techniques and breathing strategies and just different exercises to open up the pelvis during different stages of labor. So we have early labor, active labor, and then the pushing stage. And there are actually different kind of alignments or postures you should move in just to facilitate that pelvis to open at its most optimal timing. So like I said before, if you are pregnant, I highly recommend that you see a pelvic floor physical therapist. I highly recommend, even postpartum, everyone should see a pelvic floor PT at their 6-week visit just to kind of reassess things. Um, Again, after you have a baby, you tend to move like how you were pregnant because that's what your body has known to do for the past 9 months. But some of the strategies that you had during pregnancy aren't ideal to translate into postpartum, because postpartum, you don't have a baby inside of you anymore. And a lot of people during pregnancy tend to be more stiff in their spine. Their pelvis tends to be more waddly when they walk. And a lot of women tend to walk like that postpartum because they're not accessing different types of mobility or movements in their spine or their pelvis because they're so used to walking how they were during pregnant. So I highly recommend if you are postpartum to get a visit with your pelvic floor physical therapist. So like I said before, your body changes, your total blood volume significantly increases, and you have significant increases in the weight of the breast, amniotic fluid, the baby, placenta, uterus, and blood supply. Now, the blood supply, increase in blood supply is often why you might notice like swelling in your legs or having swelling in the groin or the vulva area. If you just imagine all this anterior weight, your posture is going to change. And when your posture changes or how you stand changes, your muscles have to work a lot harder to support that increase in growing weight. So, making sure you have strong glutes, strong core, making sure you're standing in a way that the muscles aren't strained or overly tensioned is really important. Changes in hormones are also a really big factor, specifically with the rise in progesterone, which can cause a lot of constipation because progesterone tends to relax everything. It tells your body to quiet down, to slow down, and the colon just kind of, well, it doesn't fall asleep, but just kind of relaxes, and it doesn't have the same colon motility or the speed to get things moving. You may feel a little stiff during pregnancy, again, because you have the growing baby inside of you. A lot of women tend to have really stiff lower backs and pelvis, and even report things like pubic symphysis pain, round ligament pain, lower back pain, so many different aches and pains due to just your body changing. And it's different for your body. Your body has to adapt to new loads. And if it doesn't have those strategies to adapt, then that's when you start getting aches and pains. So your pelvic floor is really important. And this is something I always go over with my clients during pregnancy, just educating them about these muscles. So this is a side view of the pelvic floor, or just your body. You have your pubic bone in the front, and then your tailbone in the back, and then your pelvic floor muscles span from the front to the back. You also have the uterus here, which is where the baby will be. So your pelvic floor muscles are like the exit point. If these muscles are really tight and they don't have the mobility or the flexibility to lengthen, you might have to push a lot harder to get the baby out. Now, it's the uterus that has those strong contractions that allow the baby to descend lower and lower into the pelvis. It's not the pelvic floor that pushes the baby out. The pelvic floor is honestly just like the exit gate. Again, it needs to be nice and soft. The baby, when it exits, it doesn't want to feel like it's having to push through a hard wooden gate. It wants to feel like it's pushing through something soft, like a trampoline. It wants to feel like it can easily exit without having to really try hard to push its way out. So everyone has a pelvic floor. And like I said before, your pelvic floor muscles are located at the base of your pelvis. So you can see here, this is a bottom view. You have your two sits bones, pubic bone and tailbone. Your pelvic floor muscles wrap around different sphincters. So you have your urethra and your vagina in the front, and then you have your anus in the back. And these are all the different pelvic floor muscles that need to be able to stretch. Again, this is just another side view. You can see how the pelvic floor muscles surround each canal. So there are muscles that surround the vaginal canal. So during pregnancy, the pelvic floor muscles, they're working pretty hard because they have to support the growing uterus in the baby. And then, like I said before, during delivery, you want those pelvic floor muscles to be relaxed and pliable. And did you know that the pelvic floor muscles can stretch up to 250% to accommodate the baby's head? So that's a lot of stretch and length. And a lot of that is also hormonal, so don't worry, you don't feel like you have to like manually stretch those muscles before birth, but they do have the capacity to really stretch. So there are different things that we can teach you as pelvic floor therapists in terms of just optimal positions to create more space at the bottom of the pelvis so that the baby has more room. So for example, there are some positions that can help draw these two sits bones away from each other so that there's more space. So if these are your two sits bones, if they're really close together, the baby's not going to have much space to exit. If they're really more open, baby has a lot more room. Those pelvic floor muscles can also lengthen a lot easier. So there are, again, different things, small things, tips and tricks that we can teach you to just have a smoother delivery and smoother labor. So your pelvic floor can also undergo some tearing during delivery, again, because there's so much stretch that happens to the pelvic floor muscles. And the tearing that happens in these muscles, it's like if you strained or had a mini tear of your hamstring. You obviously won't be able to walk or run as well because that would really hurt. And a torn muscle just never functions as well as a non-torn muscle. So same thing with the pelvic floor. A pelvic floor that is overly stretched or torn can feel really sore, can also result in pelvic floor muscle dysfunction, which we can talk about later, and we won't talk about that in this masterclass, but your pelvic floor muscles undergo significant trauma and just change and strain and stress to them. So it's important to, again, see a pelvic floor PT afterwards just to make sure they're healing well. Um, you can obviously check the strength of those muscles and make sure they're functioning well. Um, some of my clients, after they deliver, do experience things like urinary incontinence or feeling heaviness and pressure down there. So it's really important that you check these things out early rather than waiting later. So I'll go a little bit into what pelvic floor PT looks like during pregnancy. So again, if you're watching this and you're still on the fence, I hope these next couple of slides just give you some more information about how it can be helpful for you. And just think about, I guess, how much you know right now and any questions that you may have. You can always feel free to email me them at the very end. So what does pelvic floor PT look like? So again, I always look at your posture. A lot of my clients don't realize that they are maybe like swaying forwards or that they're jutting their pelvis forwards. They don't really know because when you're in your own body, you don't necessarily recognize all those things. I also really like to really assess the posture because depending on how you stand and sit can affect the fetal positioning. So generally, you don't really want to kind of slouch or tuck your tailbone a lot when you're sitting because that leaves less room for the baby to engage or drop into the pelvis right before labor. Another thing is when you're standing, you don't want to be kind of swayed forward and really kind of putting a lot of stretch on your abdomen because that could just put a lot of strain on those abdominals. And those abdominals need to work pretty hard for stability and stabilization of your pelvis. So how you stand affects the functionality of muscles. I also really like to assess pelvic mobility. So your pelvis is a three-dimensional structure, and it needs to have mobility in all three planes of motion because your pelvis needs to be able to move during labor and delivery so that the baby can get in and out of the pelvis. If your pelvis is really stiff, if you've been sitting a lot at the computer, working 8-hour shifts, your pelvis is likely going to be pretty stiff, and that may affect the progression of labor. It may even slow down labor if your pelvis does not have the mobility to move and rotate and allow baby to get in and out of the pelvis. So I like to give a lot of my patients pelvic clock exercises. I'll link that YouTube video below, and just different exercises to do to help open up their pelvis. I also really like to assess their lower back and their abdominal muscles. Again, just see what their strength is like. If your lower back is really tight, that could also just put more tension on the front of your body. I also like to assess your pelvic floor muscles because, again, we want them to be very happy, relaxed, and lengthened. So birth preparation sessions typically is at least a few visits. And we go over different things like pelvic floor relaxation exercises and stretches, pushing techniques, breathing techniques. Breathing is really important during labor and birth because if you are having pain and you're stressed and you're just tightening everything, that's just going to slow down the process of labor. You really want to keep all the gates, all the muscles nice and relaxed so that the baby has as much space as possible to move around and to rotate and to exit. I also really love to go over different labor and birthing positions because it's so important that you're moving throughout the process. If you're just laying in bed, on your side or on your back, just kind of buried through the pain, that's fine. But if you're moving around, being more upright, that's going to be way better because when you're upright, you're allowing the baby to have an advantage because you're using gravity to help just the baby drop and move around. I'll also link another video of different birthing positions that we might go over. You can see in this top video, this is like a partner-assisted birthing position. So I'm just supporting the patient's leg. These are some pain management strategies that are partner-assisted. So I often teach my clients' partners about different hands-on techniques that they can utilize just to relieve any pain and just provide some relief to the discomfort. I also like to instruct on perineal or pelvic floor massage, and just to give those muscles some relaxation, open up the pelvis like I talked about. I also give some other tips for pushing with the epidural, whether that's holding onto the grab bars or using like a tug-of-war technique. And then lastly, just different birth ball or peanut ball techniques, which are just great tools that you can use in the hospital to help position your pelvis in a more optimal alignment and position so you have a smoother birth. So when should I start? So I highly recommend that you really are preparing the entire 9 months. So you're not just preparing in the last few weeks prior, but I really recommend just if you're interested in starting pelvic floor physical therapy to start as soon as possible. How you move in your first trimester will affect how you move in your second and third. And as you progress with each trimester, you will get bigger in your belly. So if you are in your first trimester and you're not typically showing yet, and you're very stiff, you're already having aches and pains, you can only imagine those pains will probably get worse in your second and third trimester. Again, if you are really stiff in your pelvis, if you're just not a very flexible person, that will probably be more pronounced in your second and third trimester. And again, you don't have to be in pain or be symptomatic to do physical therapy. So if you're looking to start, I really recommend just starting as soon as possible. A lot of my clients that tend to start earlier on, we tend to space out the visits more because I know I'll have a lot more time with them. Although I do have some clients that like to see me on a more regular basis if they also have pubic bone symphysis pain or lower back pain, and there are also other, areas in their body that they like to work on. So I hope this masterclass is really informative about how you can really prepare for birth with a pelvic floor physical therapist. Just two things that you can do, easy things right now, is to move. Movement promotes blood flow. It keeps your pelvic and your hip joints and muscles mobile, strong, and flexible. Yoga and stretching are really great. So prenatal yoga I think is a great option for that. And again, just learning how to breathe. Learning how to breathe is so important because your breathing muscle is connected to your abdominals and your pelvic floor. Your abdominals are really important during your pregnancy because that is what helps provide you some stability and support. Pelvic floor is also really important because those are the muscles that need to relax at the exit point. And then breathing is just a really helpful strategy during labor and birth. One thing you have control of during that process is your breath. And if you can learn how to breathe through discomfort and pain, breathing just helps everything in your body relax if you're doing it correctly. So I highly recommend if you're going to start learning something now, it's to learn how to breathe. So again, if you have any questions, feel free to email me. You can also follow me on my Instagram at Whole Body Wellness PT, where I just post some free resources and educational content on just different exercises and tips and just helpful resources, I hope, for you. And it's not just on pregnancy kind of related stuff, but also on gut health, menopausal health, pelvic pain, and just overall wellness. So I hope you enjoyed the class and stay tuned. I'll likely have some more master classes on the channel.